What's up, YouTube? I'm Mike, and I'm on my way to the emergency room right now. I've been sick for 4 or 5 days now. I can't remember which. Sixth day, I think. I was feeling better today, and then my fever was down most of the day, and then tonight, even with Aleve and Tylenol in my system, it shot up to 103.6, I think was the highest that it read, and my resting pulse is 130 beats a minute, and I feel like death. And so I don't know what the fuck is going on, but just in case something horrific happens, I felt like I should at least document the fact that today is Sunday, April 21st at 2:10 a.m. and I'm on the way to the ER. So if I don't die en route and I get some relatively good news when I get to the ER, then I'll make another video to update you. What's up, YouTube? I'm Mike. My family's over here with me.
You wave?
Can you wave? I have been admitted to the ER, or I've been admitted to somewhere. They said I was not having a heart attack, so that's good. But they were concerned about my resting pulse was 132 beats when I got here, and they think that they're checking me for infections and maybe rhabdomyolysis. And the people at Baylor, well, I'm in Baylor right now, they have just been the fucking coolest people on earth. I'm getting the best care I can't even imagine. These people have been so nice. The doctor has even is going to give me a recommendation for a sports medicine doctor, because I was explaining that I don't go to the doctor anymore because I'm a bodybuilder, and I'm afraid they're just going to turn me away. And she's like, no, dude, don't do that. Like, there's people who will treat you. And so right now I'm hooked up to, all the usual machines, and they're doing a bunch of blood work to check for COVID, influenza, infections, and everything. So now we're just kind of in a holding pattern to find out what's been going on. But they were pretty concerned about the fact that my temperature has been elevated for so long and my resting pulse was so high. They said I definitely made the right decision coming to the ER. So I'm feeling a little bit better just now, knowing, like, that I'm not having a heart attack or stroke or anything like imminent. And so we'll see what the test results come back as. What's up, YouTube? I'm back. So they may have seen something on my chest x-ray, because they ordered a CT scan with dye, and I asked if they were looking for cancer. She said, well, it'll show cancer, but she hinted that they were looking for a blood clot. So hopefully I don't have a blood clot in my lungs. I don't know why I would, but we've been here for a couple hours now, probably, huh?
3 hours.
We've been here for 3 hours, and like I said earlier, I mean, the care has been phenomenal. I've never had a CT scan before, so it was kind of a trip. CT scan with dye. The guy told me I was gonna feel like I was gonna pee on myself, but I did not. I did not have that sensation. I just felt like there was a burning in my vein when they put the dye in. So we're now waiting to get updates on all of they've done urinalysis, they've done CT scan with dye on my chest, and looking at my heart, and they're looking for all kinds of infections, and they did a bunch of blood work and stuff. So now we're just kind of in a holding pattern, waiting for results. I don't know whether to clip these together and publish them in pieces or what, but that's what's going on. So I really hope, honestly, that they don't come back and try to tell me rhabdomyolysis, because I've always kind of like believed that was a bullshit, like fucking somatoform disorder. I don't really believe in rhabdomyolysis, but maybe I should. Oh, I thought the doctor was coming in here. So anyway, that's the update. Is where I stand right now. I still have a splitting headache. They got my resting pulse down from 132 to 108, and I've been getting a lot of fluids, and they gave me a muscle relaxer. For those of you who know my channel and my drug behaviors, before I left the house, before I decided to go to the ER, actually, I was so tired of feeling miserable that I took 2 milligrams of Xanax. I haven't told them that yet. They surprisingly haven't asked me a whole lot of questions about what I do. I told them that I take a lot of bodybuilding drugs, and they've been really like hands off about all that, which I've been surprised about. So I'm operating on 2 milligrams of Xanax and 60 milligrams of dextromethorphan from my chest and whatever muscle relaxer they gave me. So that's what's up. As soon as I know more information, I will update this video. I may publish this now and then publish the updates later. So as always, thank you for watching, and we'll see you on the next one. What's up, YouTube? I'm Mike. So it turns out that I have pneumonia in my left lung. So they're about to cut me loose with augmentin and doxycycline, which will hopefully get me back on my feet pretty quick so I can get to bodybuilding again. So that's what it was. I'm glad, I guess, I finally came down here, because it was probably not going to get any better on its own. I kept thinking that it was just viral and that I'd be able to kick it at home. So I guess it's good that I came in and got it sorted out. So that's the deal. Hopefully when I get to feeling better, I'll be back to making some better content for you guys. So as always, thank you for watching. We'll see you on the next one. What's up, YouTube? I'm Mike. I just got back from the hospital. I wanted to shoot a little follow-up for this otherwise pretty short video. I talked to the doctor, like I think I mentioned in my video at the hospital. The fucking doctor, the female doctor at Baylor, was the coolest person I've ever met. She was like, there's no reason for you to be ashamed of your bodybuilding, and whatever drugs you're taking, like, there's no reason that you can't get medical care for that. I told her that I was like, I quit going to the doctor because my doctor was always just telling me basically to just get off gear. And she's like, no, that's crazy. She's like, I've got a guy for you. So she gave me a recommendation for a new doctor. And so I'm going to check that out. But I wanted to give you guys some updates because I kind of grilled her pretty hard there at the end, because they did a CT scan and x-ray of my chest cavity. And so I asked her if I had any signs of congestive heart failure, and she said no, that I was all good on that front. There was no immediate signs of arteriosclerosis from what they could see, but that was not really a good test for that, that there would need to be other tests done to definitively rule that out. I asked her if she would look at my heart from the x-ray and tell me if there was any signs of left ventricular hypertrophy. This is something that you guys have been asking me about quite a bit, because I use Deca and Tren and large amounts of cabergoline for long periods of time. And she did say that there was some thickening of the wall of my heart, that there was some signs of left ventricular hypertrophy, but she did not definitively
blame anything that I was taking for those effects. Everything that she mentioned two things that she felt like I needed to get with a general practitioner that she recommended and basically follow up on. She was super cool. She was like, I'm not telling you you need to stop bodybuilding, but I am telling you that, you have some signs of some issues. And so the two issues that she said she was most concerned with was that because my main doctor is at Baylor, and that's where I went, they have like all my patient history, and my creatinine levels have been rising steadily for the past several years since I started bodybuilding. And so she said, it's looking like you're starting to strain your kidneys. And I said, well, fair enough, but like, admittedly, you can't point the finger at anything that I'm taking, right? Like, it could be just symptomatic of the fact that I do bodybuild, and the stress that bodybuilding puts on your body can negatively affect your kidneys. And she said, yes, that's true. I'm not definitively saying that and she didn't use these terms, this is my term, that my drug abuse, basically my steroid abuse, is causing kidney function problems. And she says you're not like in a danger zone, but you're trending up there. So she told me that my kidneys are getting to the point where I could start developing some kidney disease if I did not take my kidney health seriously. So she recommended a kidney doctor for me to follow up with, just to keep an eye on what's going on. I will probably not go to the kidney doctor. I will probably use this new information as an excuse to come off blast here when I'm done growing and get new blood work to see where my creatinine levels come down to when I get back to normal, semi-normal physiological state. I may schedule a visit with this new doctor, and just for peace of mind, to have somebody that I can talk to honestly about everything that I've been doing, go over all my current, previous, post blood work, and get a full workup, see what he thinks is going on. Again, as far as the left ventricular hypertrophy, she did not definitively blame any of the drugs that I'm taking. She said that it definitively is also just caused by, obviously excessive bodybuilding, and that, it's just something that I need to be aware of. Obviously, she's a doctor. She's like, we want you to live forever. And I kind of joked, and I was like, well, but let's be honest, right? Like, basically the things that you're telling me are not going to kill me tomorrow. Like, even if I keep doing what I'm doing, we're talking about 10 something years down the road. And that kind of admittedly, like, took her off guard. Like, she kind of scoffed at that, and she was like, well, yeah, like, I don't really like to think about it. Like, I'm not really advising a patient on, like, hey, you can keep doing this for the next 10 to 15 years. That's not really the way medicine works. Like, we're telling you that you're stressing your body, and that there could be deleterious effects to your health because of it, and we want you to live as long as possible. So, and like, she was real hands off. Like, that was the thing. Like, she was not in my ass. She was like, I respect your decision. I respect your desire to bodybuild. I know you're going to do what you're going to do. I'm just giving you the information that you need to have so that you can follow up with, other doctors and stay on top of exactly where your health is. And so, if anything that I've learned from this experience, it's that I'm fucking not invincible. And while it doesn't seem that there's any strong evidence that any of the anabolic steroids and ancillaries that I've used thus far have put me have put me currently into a diseased state, it does seem pretty clear that if I continue down the path that I'm going, that a potentially morbid condition is around the corner. Now, again, I'm going to have to do some of my own research because, I think she was a great doctor. I think she was very genuine, but by her own admission, she's not obviously up on the latest medical science as far as the effects of bodybuilding on the human body. And so I think that it's very possible that some of these heightened markers are just that. They're transient heightened markers because of the stresses and strains that blasting and intense bodybuilding put on the body. I suspect that the reason that I got sick to begin with is because I started training 6 days a week again, and at the age of 43 and in my current state, I was training 6 days a week because I was trying to use my Planet Fitness guest pass to cover both my wife and my son. And so they were basically alternating. So I was going 6 days a week so that they could each get in 3 days a week, and it was just too much for my body. And I hate to use the word overtrained. I don't know that that's really what it was, but I definitely started feeling the weight of the recovery periods, trying to, go max, trying to go full tilt 6 days a week was, I think, really just more than I was able to recover from. And I think that that's what put me in a weakened, immune state and led to this case of pneumonia. So very happy to have, I'm very happy to find out that I don't have congestive heart failure, that I don't have, that there's no good signs of arteriosclerosis, that my heart muscle is effectively good. There's some signs of thickening, but nothing that I feel like I need to be immediately concerned about. And then I'm going to need to be a little bit more aware of my kidney function. And so the compounds that I use and the durations that I use and the hydration levels that I maintain, are going to be important going forward as to, I'm definitely going to pay more attention to my kidneys. They've sort of taken a back seat to everything else. And because my kidney function has always been good, and she felt like that there was a definitive negative trend in my blood work. So obviously that's something I'm going to try to curtail and get under control, because I definitely want to continue to do this for as long as I can. So, I'm glad, I was pretty nervous when I left the house. Like I said, I've been feeling really bad the last few days. I'm always apprehensive to go to the emergency room, just because I feel like, 9 times out of 10 it's nothing and you waste time and money. And I think we made a good decision today, because the pneumonia was likely not going to go away on its own. So we're waiting for the pharmacy to open so I can get a couple of doses of antibiotics in my system before the fever and the misery returns, and then try to get some rest. We've been up all night long, so pretty beat. But I just wanted to wrap this up. It was kind of a scary thing. We've been debating for 2 days about whether to go, and it's just such a pain in the ass going to the ER. And I think it ended up being really the best decision possible, because it's possibly led me to some new medical contacts and gone a long way to put my my mind at ease about my general health. Clearly, while not ideal, my body's looking pretty good for 43 years old, and the considerable amount of long-term steroid abuse that I exposed my body to. So there you have it. Sorry for the drama-filled intro. I honestly didn't know what was going on. I felt god-awful on the way to the ER. My mind was racing with all the things they might tell me, was causing it. And so I think pneumonia is a pretty, I mean, nobody wants pneumonia, but I feel like it could have been a hell of a lot fucking worse. At least it was nothing to do with, any of my injectables. I haven't been injecting any toxins. They didn't find any sepsis, any kind of septic, toxic situations going on in my body. So obviously the QSC gear that I've pinned 30, 40 bottles of is clearly pure. I'm clearly not getting sick from that. There's basically no signs that what I've been experiencing the last few days, last 4 or 5 days, has had anything to do with my body, with my steroid cycling, other than maybe that I got overtrained a little bit and a little bit worn down, which made me susceptible to getting a bout of pneumonia. So you can get these antibiotics in my system and hope to feel better soon. As always, thank you for watching, and we'll see you on the next one.